So Kate, how would you describe what CORC does and what CORC is?
So CORC is a membership organisation. We're a learning collaboration, and our members are mental health and emotional wellbeing services, as well as schools and colleges and research institutions and policymakers and commissioners as well. So a whole range of organisations, and they are all really committed to using evidence and the real world evidence that they collect to improve support for child and youth mental health. So we support them in their context to collect the best possible information about the outcomes of care for the children and people that they work with, and we also collect that data nationally so that we can do research and answer questions that are of interest for everybody. And we really are about learning from each other and disseminating what we learn as much as possible. So we have a really active engagement through our membership support officers who are based regionally, and we have our monthly newsletter, and we're always trying to put things, have new blogs and case studies on our website, and we're active on Twitter and things as well. So, yeah. I mean, how about you as one of our board members? What's drawn you to CORC?
So I guess what drew me to CORC was a sense of, like, the research world sometimes feeling quite like this other world that I couldn't quite understand. And I having been through services myself as a young person, I want to be able to understand the research and understand how we need to think about services in a more evidence-based manner and think about improving upon offers to young people, whether that's in schools or whether that's in specialist services. So yeah, I guess I wanted to join the board of CORC and be more involved in CORC to think not only about existing research that's happening, but also how we can expand to think about research and outcomes measures in general, to include young people more in that conversation, and to make sure that young people are informed generally about what's going on in their care and their support, because that's a really important part of what CORC does. You know, we collect information about what is and isn't working to inform how decisions are made going forward.
And I think historically, and still a really important group that we work with, was the practitioners and the services, and it was them and actually clinicians who really wanted to understand the impact of what they're doing, who initially set CORC up in 2002, and it was very much a grassroots evolution from there. And now we really work a lot with commissioners as well, and we understand that they need to understand ways you think about what a good result is, and the way that you hear from the people who are experiencing the care, the young people and families, about whether or not they're working for them. And so commissioners are a really important audience for us now. And of course we're a lot in schools and colleges, because they're more and more realising that they can support and play a real role in helping children and young people in this area as well. So it's actually quite recently that we've woken up to how important it is to have young people directly involved in CORC as a membership organisation, and to ask young people to join our network and inform our debate really directly, not just at second hand through the services and practitioners that we work in. And I think that's really opening up what we do and making sure that it's still meaningful and helping with person-centred responsive care.
And I think that's the crucial and important role that CORC is playing at the moment. You know, mental health as an area is moving out of specialist, out of just specialist clinics, and opening up to a wider range of providers and people interested in the topic in general. And we're there to help them and facilitate them in knowing how and why different support works for them, and how to collect that information and measure it.
Yeah, we have a wider and wider range of people signing up to our network and joining us as members, and the debate just gets richer, and our understanding of how we help and the types of support that we offer, and the ways that services that can have a positive support can have a positive impact, just getting better.
So I suppose if you're interested, do just give us a call, get in touch to find out more.
Yeah, look at our website,
absolutely,
on our Twitter feed,
and our newsletter and our YouTube. So we give a lot of free resources out. We do a lot of blogs about new research recently being published and things, and we have a great membership offer. So yeah, get in touch.